Initially, I felt that I was the patient initially, and that my care provider was the expert in what I should do, how I should feel, what I should do to take care of my baby and my pregnancy. And in getting to know the midwife and having her ask questions and let me know that I was in charge of my body and I could utilize her as a resource and ask her questions, I felt much more empowered as a parent. I felt like I was a consumer and I could be informed and have a choice and ask for her assistance. And I think I actually asked my midwife for a lot more information because I felt like I was in control of the situation. The procedures that were being done were explained to me, and if I had a question about them, it was addressed, and I was given evidence-based information, up-to-date information on what the procedure was, why it was recommended, and then given the option to choose it or decline it, and felt very free to ask my midwife what her opinion was and what her recommendation was, and felt that I could trust what those recommendations were. I noticed with the midwifery care that my provider felt very accessible to me. So when I had questions following my birth, my postpartum recovery, breastfeeding, I felt like I could call and get a hold of somebody or have a call returned to me in a very short period of time, and it didn't feel like such an expansive channel to get to help, to get to information that I needed, and to have someone that I knew me. So the midwife also worked really beautifully with my family practice physician. So concerns that I had that were not pregnancy related, co-current issues that I might have going on, she was very willing to communicate those with my doctor. And my doctor had a very open relationship with my permission to share that information back with my midwife. So it was a beautiful relationship that I was able to have with both of my care providers and without any animosity. When I think back to the most rewarding part of each of my childbirths, I think of the moment that I met my baby. Because I've had 4 children, each of those births gets fuller in my memory because my other children and their father got to meet a new baby. So the most rewarding birth for me was probably my last birth, where our whole family was able to attend together, and it felt very organic and very comfortable and very natural that we could all be together in an environment that was suitable for small children, suitable for my best friend, suitable for me and my partner, and felt like a family celebration, not a medical event. I never felt like it wasn't under control. I never felt that I was just hanging out there. I knew that the midwife knew what to do to help me if there was an emergency, and that I would be well taken care of. Based on my whole prenatal history and the listening that she did and how well she knew my circumstances, let me know that she would take care of me no matter what, and would know exactly how to react in an emergency or at the happiest moment of my life. I think probably the most important benefit of experiencing a natural childbirth was that I was so empowered afterward that I felt like I achieved my birth. I gave birth to this wonderful baby, and therefore I could do anything.